Welcome to TMJ Unpacked, where we learn, collaborate, and rethink how we approach jaw pain, facial pain, and sleep through an interdisciplinary lens. I'm Dr. Natasha Nagpal, a dentist working exclusively in the area of craniofacial pain and dental sleep medicine. And this podcast is not about me having all the answers. Instead, this is a global learning platform where we bring together different perspectives, share clinical experiences, and most importantly, grow together so that we can serve our patients better. Whether you are a patient searching for clarity or a clinician looking to think differently, you are in the right place. This is TMG Unpacked. Today's episode is the foundation of this entire platform. We're going to talk about why joint pain, facial pain, sleep cannot be treated in isolation, and why an interdisciplinary model is essential for real, lasting outcomes. Every day in my practice, I meet patients who've already seen multiple providers, dentists, PCPs, physical therapies, and sometimes even neurologists and ENT specialists, and they're still in pain. Not because treatment was wrong, and not because the providers didn't care, but because they were placed into a system that looked at only one piece of that much bigger picture. TMJ is not just a joint problem. So when we talk about TMJ, we mean temporomandibular joints. TMD, temporomandibular disorders, which is a complex condition involving your joint, muscles, your spine, airway, sleep quality, nervous system, and even behavioral and psychosocial factors. And when we treat only one of these components in isolation, yes, patients do get temporary relief. But they rarely experience long-term resolution. Many patients present with significant muscular pain, cervical involvement. And if we focus only on the joint, ignoring the surrounding musculature and posture, we actually miss the major driver of their symptoms. Sleep plays a critical role in pain modulation and muscle recovery. So, when a patient has sleep related breathing disorder or poor sleep quality, the nervous system remains in that protective state. And unless sleep is evaluated and managed, their symptoms continue to cycle. And pain is not always directly proportional to structural findings. So, a patient may have imaging normal and they still experience severe pain. This is because, chronic pain involves changes in how the nervous system processes and actually amplifies signals. Understanding this shift actually changes the conversation from what is structurally wrong to how is the system functioning. And real progress will happen when care is collaborative. When dentists, physical therapists, sleep physicians, neurologists, our primary care physicians, clinical psychologists work together, patients actually finally begin to move forward. And this is not about one provider doing everything. It is about understanding when to treat, when to refer, and how to co manage. If you've been searching for answers for years, please know this. You are actually not a difficult case. You are not imagining your pain. You have an not failed treatment. You are a patient with a condition that requires that comprehensive and interdisciplinary approach. For clinicians listening to this platform is an invitation to collaborate, to learn from one another, and to rethink how we approach complex pain and sleep related conditions. No single discipline owns this space. And that is exactly why interdisciplinary care is so powerful. On this podcast, we will continue to unpack the connections between the joint, the muscles, airway, the nervous system, posture, behavior, and sleep. And most importantly, how collaboration will actually change outcomes. If this episode resonated with you, share it with a colleague, a patient, or anyone who's actually searching for clarity. This is TMJ Unpacked, and I'll actually see you in the next episode.